Hi, my name is Bella, and this is my theory-based presentation using the case of Saundra Santiago. So beginning first with her presenting problems, she has recently fled an unsafe and toxic domestic situation as the result of the verbal, physical, and emotional abuse from her boyfriend. She's currently homeless as well and residing at a short-term domestic violence shelter, Safe Haven Shelter, and is further lacking financial resources to sustain living independently. So my biopsychosocial assessment of Saundra, she's of Puerto Rican descent, no health issues. She is currently employed part-time, and she doesn't currently have any medical insurance and is not utilizing social assistance. She does have some strained familial relationships due to childhood trauma and a strong connection to her Catholic faith. She's also motivated towards progress. She self-referred herself to the shelter and willingly attends the support group there. So the applicable mid-level theories I've chosen for Saundra's case are crisis theory and narrative theory. So beginning first with crisis theory. So essentially, crisis theory states or postulates that stress is an unavoidable human experience, but that we have the capacity to overcome these stresses when equipped with the appropriate tools and resources. It further proposes that a crisis is not determined by a situation itself, but rather an individual's response to a stressful event. So crisis theory-based interventions focus on guiding clients from disequilibrium back to their baseline level of functioning and building resilience and distress tolerance to future crises. So there's many strengths of this theory and its interventions. It's a brief intervention that can be implemented with individuals in active crisis. So it would be suitable for Saundra's current situation. It's strength-based and encourages individuals to lean on their natural and community supports. Some limitations, the brief intervention format may not be suitable for all individuals, particularly those with chronic problems or severe mental health diagnosis. There are potential practice limitations when engaging with clients who are reluctant to adopt new coping skills, as adopting new coping skills, coping mechanisms is really the crux of this approach. Individuals who are less receptive may not be as suitable for this intervention. Implementation. So crisis theory-based interventions are fitting for domestic violence situations, as these clients are in significant distress due to the active crisis and therefore hopefully more receptive to outside intervention. This can be employed using Robert's 7-stage crisis model. In Saundra's situation, following this model, I would immediately begin engaging in rapport building, using micro skills such as active listening and empathy, while simultaneously completing her biopsychosocial assessment. So it's crucial in this intervention to move quite quickly and efficiently through both the assessment and engagement process due to the time restraints or time constraints of this intervention. It would also be critical for me to make her feel safe and validated, particularly as her feelings have been ignored and discredited both in childhood and in her most recent relationship and her current active crisis. She needs to be praised for the bravery to take the first step from freedom from abuse to independence. From her assessment, I will be able to identify her household situation as an imminent danger, particularly as she's now left her boyfriend. There is a greater chance he would retaliate with physical violence. We also know from her interview that he had threatened her with a knife in the past. So the two major problems at play here would be the active danger of the abuse and also her inability to sustain leaving this relationship due to a lack of financial resources and support. So exploration of her feelings and emotions demonstrate a hesitance to leave her boyfriend, which is not uncommon at all in these situations. and also a dependence on him emotionally and financially. So implementation of new healthy coping skills would include finding alternative ways for her to fill that need for emotional support from her abusive boyfriend, encouraging her to swap negative self-talk for daily affirmations, which would also assist in building her self-esteem, and completing a gratitude list or something similar to help remind her of the positive things that she's accomplished in life despite the hardship and odds stacked against her. Maintaining her education, in completing her education, maintaining sobriety, and maintaining employment. So her action plan should include tasks that assist her in obtaining financial independence. She was quite hesitant to apply for social assistance, so I would instead make the suggestion that she work full-time rather than part-time. This would not only enable her to become eligible for health insurance benefits, but would also keep her busy via a healthy distraction that helps her work towards an attainable goal. So she should keep attending the support groups at the shelter as well, which would keep her engaged in camaraderie amongst individuals dealing with similar situations. Finally, I would schedule a follow-up for Saundra after she's begun implementing some of these changes in coping skills to determine her level of functioning and if any additional referrals need to be made. Moving forward next to narrative theory, which is my theory and based intervention of preference for Saundra's situation. Narrative therapy assists clients in gaining an understanding of their lived experiences through sharing their personal stories or narratives. So it's an empowering process that emphasizes individual strengths. Narrative theory postulates that self-knowledge is power and that this power can be directed towards an individual's healing process. It also proposes that the meanings we attach to our individual experiences are heavily shaped by social, political, and cultural surroundings. Further, that the problems in our life are separate from us as individuals, but rather stem from these macro contexts. So narrative-based interventions assist clients in rewriting their stories and building strength from our past experiences and challenging these socially constructed truths. So the strengths of this theory and its interventions are that it's very client-centered and collaborative. It positions the client almost as the main interventionist of their own treatment, culturally competent and adaptive. It also, as I mentioned before, targets systemic as well as individual factors of client problems by acknowledging the role of this social construction and challenging it. Limitations include the limited empirically based evidence of its efficacy. It may not be suitable for integration in all healthcare settings. Also, it can be triggering to recall trauma-laden events of a person's life. There is a way that this limitation can be managed or provisioned for, which I will discuss in a later slide. So implementation. Narrative theory proposes that the social worker is really the guide to a client's intervention. We should listen, wonder, and ask reflective questions to encourage the client through the narrative process. This can be done through White and Epstein's deconstruction and reconstruction. This encourages reinvention of self. It would empower Saundra to view herself as a survivor rather than a victim. So deconstruction, first it's critical for me to hear Saundra's story before challenging or deconstructing anything. I, as the social worker, need to validate her lived experiences and build rapport through the active listening, empathy, and reflective questions to determine the meaning that she ascribes to particular events. I want to figure out what she defines as the presenting problem and which social, political contexts are underlying these issues. So this storytelling process would also begin to externalize the problem to Saundra. So as discussed before, this theory emphasizes that a problem is not intrinsic to a person themselves, but rather something that's occurred to them during their life course that can and should be challenged. And then incorporating the learned social, cultural, political context from the storytelling process, I can then begin to deconstruct, we can then begin to deconstruct the problem to make it more specific and manageable. So some statements or questions I would use throughout this is, I can imagine it must have been very difficult to grow up in a single parent household and then go on to essentially raise yourself. I'm sure you learned many skills of survival and strength during this time. Can you tell me about those? So this, again, reiterates the social, cultural, political context and also emphasizes her strengths and resilience and encourages her to acknowledge these. How do you think society and culture has impacted your family views surrounding a woman's role in a relationship? So that challenges some of her maladaptive thoughts she has surrounding herself within her relationship with Eric and also her mother's as well. Do you think your mother's views have been about your relationship with Eric have been influenced by this? When did you start to feel as though you needed to manage Eric's violence towards you? When was the first time your relationship with Eric made you feel small and unloved? That was a sentiment she mentioned during her interview, which stems from the words of her mother. So reconstructing. So I would ask Saundra to tell me about any past relationships where she did feel good and valued and how this impacted other areas of her life. So that encourages her to recognize that she is capable of being loved and valued, and also encourages her to recognize how this positively impacted other areas of her life when she did feel that way. What has been successful in the past for you to overcome hardships? How has your faith carried you through challenging times in the past? And is there anything we can do to help you lean into that support right now? So her faith is integral to her. So it's important to really highlight that throughout this process. It's also important to mention that this narrative process doesn't just have to be oral. It can be employed through alternative means, visual, written, etc. And since Saundra enjoys writing and expressing her feelings on paper, this was something emphasized during her assessment. I think it would be therapeutically beneficial to encourage her to write a narrative in a poem or journaling format that she could then share with me and share where she feels things went wrong throughout her life. And I could then guide her to determine those precipitating events and the context of these issues, separate from her as a person. Saundra's job could really be a safe place for her. She enjoys working and it fosters her independence. So I would ask or say, your job values you as an individual and an employee. Where do you see yourself in the next 5 years at this company? Do you think working full-time would help you feel more financially empowered and independent? So that's my intervention plan for a narrative theory-based intervention for Saundra. Now, it is important to discuss some considerations. Now, these are applicable with either intervention, crisis, or narrative, and any really. So the client does have a history of substance use, which would be very important for us to remain cognizant of as a social worker, as it could become a maladaptive coping skill in the form of a relapse. She has extensive complex trauma. So a trauma-informed approach is critical here, particularly if employing narrative therapy, which I would be. So I mentioned this before. So instead of having her repeatedly recall those traumatic events, it would probably be best to have her only recall them once and then that be it. Codependence is present in her relationship, which makes it more likely she would return to the abuse. So coping skills that manage this dependence is crucial as well. Further area to consider, power differentials in practice. So narrative therapy, as it's such a client-centered approach, it does align with a social work practice that challenges power dynamics present within client-professional relationships. Her personal expertise is viewed as equally, if not more valuable than mine as the social workers, which promotes the meeting the client where they are approach, discussed in the Sakamoto and Pittner article of this module. In the case at hand specifically, there's several contributing factors toward the power differential between Saundra and her social worker. Her domestic and financial situation puts her in a very vulnerable position where she's not only relying on the shelter for therapeutic services, but quite literally a roof over her head. So her imminent crisis and subsequent dependence unequally distributes the power between herself and, I've put Judy, but in this case, it would be me, the social worker. So her dependence on the shelter makes her vulnerable to abuses of power. Again, something to remain cognizant of throughout treatment. So that is the end of my case presentation. Thank you for listening. The last slide here is my references. Thank you again.